It's been described as one of the most horrific medical treatment disasters in the history of the NHS. And today, a leading doctor from Oxford has been giving evidence to a public inquiry. Thousands of people were infected with HIV, hepatitis C and other viruses when they were given blood transfusions in the 1970s and 1980s. Penny Sylvester has our report.
The inquiry has heard that more than 2,000 people died and more than 25,000 could be affected today. Patients at the Oxford Haemophilia Centre at the Churchill Hospital were among thousands of patients infected with hepatitis C from contaminated blood.
We were all given blood products that were meant to help us, to save us, but in fact made our lives a catastrophe. It really has been hell living with haemophilia alone, but having this bolted on as well, it's just made each day unbearable. And to get to the bottom of it, to find out that it's not a computer blip, there wasn't a mechanical error. Somebody decided to say, yep, that treatment is safe to give, and in fact it wasn't.
Haemophilia means the blood doesn't clot. Patients were treated with a blood product known as factor VIII. Throughout the 70s and 80s it was made from imported plasma, much of it from America, where high-risk groups such as drug addicts were paid cash for giving blood. Campaigners say experts chose to ignore the warnings and continued to give patients infected blood for at least another decade. Many also claim they were tested for HIV or hepatitis C without their consent. Today, the man in charge of the Oxford Centre in the 90s responded.
I had assumed that consent had been forthcoming, but I'm not going to contradict anyone, and I'm by no means confident that consent was obtained in all cases.
The inquiry is also looking at whether the Department of Health knew people were being infected with contaminated blood but chose to ignore the problem. Penny Sylvester, ITV News.
And the inquiry is expected to go on well into next year and hopefully report by the end of 2021.